Great. Welcome, everyone. Thank you so much for joining us this afternoon. My name is Rachel Henesy, and I'm joined by my colleague, Alexandra Russo. And we're here today to speak about navigating transitions in care for AYA patients. We are here today from Memorial Sloan Kettering Cancer Center, and we're both based in New York City, but MSK also has regional offices in New Jersey, Long Island, and Westchester. So I've been a clinical social worker at MSK now for a little bit over a year, but I've been at MSK for over 4 years. I previously worked as the program coordinator for the AYA program before joining the social work department.
Hi, everyone. As Rachel mentioned, I'm Alexandra Russo. I'm also one of the clinical social workers for our AYA program. So we just like to highlight a little tiny bit of the history. So our program did start in 2020, really again to address all of the needs and unique issues that we've heard discussed with some detail this morning of the AYA patients who are being seen at MSK for their oncology-related care. In addition to ourselves, part of our AYA program, we have a nurse navigator and a nurse practitioner that we work alongside with. And so our program really does encompass the clinical, psychosocial, and peer support aspects of a patient for their care. We're happy to have you all today. We are going to just briefly, a couple objectives today. We're hoping that you will gain an understanding of the various transitions in oncology care that AYAs may experience. We're hoping that you will understand the impacts these transitions have on the life of AYAs and to feel more equipped to address and provide support to AYAs with these transitions. So we've heard a lot of this morning, thankfully. We've had great introductions already, so I'm not going to go into too much detail about what is an AYA, but just to clarify, as has been discussed, sometimes different age ranges are used. We do also utilize the 15 to 39-year-old age range. So again, part of why we are all here today, obviously, discussing this population is due to the fact that, this is a really unique group of individuals whose needs and concerns often differ from those of younger adults or younger children and older adults. So it, just kind of like anecdotally speaking, also a lot of times when we're talking with our patients, they are not aware that this distinction has been made for this age group. And even sometimes when we're talking to folks in their, mid 30s and we say, we're calling from the young adult program, they'll sometimes say, well, I think you have the wrong number. That's not really who I am. But, we clarify kind of why we use that term. But I think, for a lot of young adults, it is helpful once they are for us to name that they are part of this unique group and to really kind of highlight the fact that there are some specialized services for them. Okay, so again, we actually were very excited that Matthew used this study. The graph here is, it's old, but we're using it because as Matthew really outlined so wonderfully, it's from a study that was published in 2006 that really was foundational to the AYA cancer movement. So it really helped to inform the need of AYA-focused care across oncology, and it led to the growth of clinical programs focused on this population throughout internationally, really. So again, this study really concluded that there were minimal advances in cancer outcomes in the AYA age group, and identified a number of reasons, which include issues that unfortunately still remain true today, and why some of the issues that we continue to see, including a delay in diagnosis, a lack of standardized treatment across adult and pediatric centers, low clinical trial enrollment, as well as the psychosocial challenges, some of which again were discussed this morning. In addition, financial toxicity has shown to have a really immense impact on patients' outcomes, as it often impacts really their ability to engage with and maintain consistency with treatment. So again, kind of highlighting today the fact that the incidence of cancer diagnoses in the AYA population is rising. Unfortunately, people are getting diagnosed with cancer younger and younger, with really a notable increase in their 30s. And again, this statistic was used, but I think it's helpful to reinforce that about 4% of cancer diagnoses in 2024 were among the AYA population. So that's more than 85,000 people in the United States. With that has also come an increased awareness. As you maybe have seen in some recent kind of media outlets and headlines, we just put the one up from Time, which was published in February of this year, and there were patients from MSK profiled in that piece. So, it's really important as again, we're talking about the idea of advocacy for awareness to be more prevalent. So we're, it's all unfortunate that we're seeing more of this, but, happy that there is some attention being paid. So like many AYA programs, ours at MSK really grew out of, this foundational research, looking at the need, and we're paying close attention to each of these factors, which have really been shown to impact outcomes for AYA patients.
So we're going to talk a little bit today. First, we'll go through some different stages in a patient's cancer treatment and experience. Now, of course, these timelines and the order we're going to go through them in it's not always linear. People, go in all different directions throughout their care. But we're going to just talk a little bit about the transitions that come up throughout those different stages. And then in the second half of our presentation, we'll talk about what can we do, what can we all contribute, what can you in your roles contribute to help mitigate some of these and support throughout these transitions. So to start, we're going to talk about at the time of diagnosis. So of course, this brings on a very new experience for most of these patients, emotionally, logistically, and financially. So emotionally, patients experience a wide variety of emotions. And like anything in life, this really varies patient to patient. So this could include shock and numbness, not really able to process what's going on, maybe not accepting what's going on. A lot of anxiety, of course, comes up, especially around the uncertainty of a diagnosis. Sometimes there's, as we said, a delay in diagnosis. Maybe they've been experiencing these symptoms for a little while and they're finally getting a diagnosis, but now what? And there can be a gap between that time of diagnosis and starting treatment. Sometimes there's more tests that need to be run, establishing where they want to get their care. So we have found that a lot of times the anxiety around that uncertainty can kind of diminish and improve once they're up and running in treatment, but that really initial acute anxiety at diagnosis is high for a lot of patients. Of course, it also brings up fear, and for young adults, a sense of mortality at an early age. And then also things like anger and frustration. Why is this happening to me? And of course, sadness, just as a general feeling. And all of these things also affect a patient's support system and how they relate to it. So, who's there to step up to help with them? Are there already pre-existing complicated familial dynamics that come into play while navigating a diagnosis? How are they sharing with their support system? A lot of times there's a burden on these young adults to share with parents or with partners. And of course, talking with young children, as we spoke about a little bit in some of the earlier presentations today, of course, brings up feelings on all sides. And also with children of not knowing, should I share? What should I share? How much should I share? And how can I help them understand this and understand what this means for them? So patients, also as they're, young adults, not all, but a lot, this may be their first, exposure to navigating a complex hospital system and dealing with a lot of medical needs. So, this is a new experience. There's a lot of logistics to manage, and this is affected by, a patient's individual health literacy. So when we talk about health literacy, just a quick definition, it's the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions. So this could mean understanding instructions that come with their prescription drugs, their doctor's directions and consent forms, and the ability to navigate that complex healthcare system. Patients also have a lot of complicated and highly impactful decisions that they need to make at times of diagnosis, and they may need extra support in making those decisions. So again, that varies based on the individual patient's support system, the familial dynamics that can come into play, and emotions and opinions of those within their support system can make making those decisions particularly complicated. And then, of course, with navigating a hospital system, just a lot of logistics, managing their schedules, appointments, when they need to take their medications, keeping track of side effects and questions they have throughout this. And then this can have effects on their ability to manage other things such as employment or school. So making decisions around, am I going to continue to work? Am I going to be able to continue to work? How flexible is my job? We have patients who work fully remote in sales, and maybe they can keep working. I had a patient who worked their entire treatment because their job was extremely flexible. Then I have other patients who are preschool teachers who can't work at all. They can't be in a school where they're being exposed to germs at all times. So really depends on the patient and their comfort level, and also their diagnosis and how it's going to affect them. So navigating those complex decisions and sometimes having to make those decisions in a tight time frame. And with that also comes disclosure at work. And so navigating, who do I share with? How much do I have to share? What shouldn't I share? We heard about cancer and careers earlier. We heard about the impacts of a social media footprint and what you're sharing online. So having to navigate those difficult things as well. And additionally with school. So for those with our younger adolescents or college or grad school, am I going to be able to continue with school? Will I be able to graduate? Where do I go for help within my school system? And how do I share? How do I communicate? And finally, impact on finances and needing to quickly understand a lot about insurance. So again, if this patient hasn't had a lot of past need for medical care, maybe they've just had a physical every year and some annuals, all of a sudden they have to understand their insurance that, they may not have even barely read through what they got from, HR at work or in the mail. So needing to quickly, kind of understand all of that and navigate that, which I know I at least find insurance really challenging for myself. So I totally understand for patients, especially some of our younger patients. So also navigating, we talked about, again, this morning, turning 26 and aging off of parents' insurance. So when that time comes, what is that going to mean for my care and where I'm receiving my care? So then as they transition into active treatment, so meaning they are up and running in their treatment plan, as I noted before, a lot of times some of the uncertainty and anxiety can ebb for patients, but then a lot of different emotions, challenges, et cetera, can come up. So there are, of course, some major buckets of treatment that patients can undergo depending on their diagnosis. Sometimes they are receiving one type of treatment. Sometimes they have multiple within their care. So surgery, chemotherapy, radiation, or transplants. And with these treatments, as we know, often come side effects. So some of the well-known ones, things like nausea, loss of your hair, and fatigue, but also some maybe less known like chemo brain or trouble with thinking and memory as a result of chemotherapy treatment, significant pain from radiation or other treatments, and higher risk of infections and need to monitor for symptoms of said infections. So I know Kyle mentioned fevers and, just dreading getting a fever because he knew it would mean he had to be in the hospital. So, this requires patients to be very aware of their symptoms and clear and oftentimes proactively communicative with their medical team about what they're experiencing. And as we mentioned before, there's also often a high number of appointments that come with treatment. Sometimes it's daily. We have patients who are coming for daily radiation or just daily labs, hydration, and this has a significant impact on their schedule and their availability and energy level for things like work or other commitments like family. So the appointment burden can be very high, especially during initial active treatment. And then sometimes there are shifts in the treatment plan throughout a patient's care. So as I mentioned, sometimes this is just due to the treatment plan having multiple steps and they're moving on to the next step, or sometimes there are changes in treatment due to a progression of their disease or a lack of response to the current treatment. And this, of course, can be very difficult for patients to process. Understandably very frightening and difficult to navigate adjusting to a new treatment, including a new cadence of appointments, sometimes even a new oncologist or a new provider of certain treatments, different side effects and schedules. And then all the uncertainty of how will this treatment work and how will it affect me. And then there are times when patients often need to be admitted inpatient. So whether that's planned or unexpectedly. Patients can feel very scared about what to expect during an admission, especially if this is something they have never experienced before. For anyone who's been in the hospital or been exposed to one, it's not very comfortable. You're not getting a lot of sleep typically, don't have your comforts of home. You might have a roommate. and varying visitors' policies. So who will be able to be with me? How often will I be alone? Can I see my children? Things like that come up during an admission. For a planned admission, something that they know is coming and can prepare for, of course, a little bit less uncertainty, and they can, make sure to have a plan in place for it to be as comfortable as is possible. But any long hospital admission has a significant effect on patients, both physically and mentally. And then throughout patients' treatment, there can be feelings a lot of times of social isolation. And this is exacerbated by admissions, treatment side effects, and sometimes the need to just avoid, exposure to others due to their weakened immune systems. And this, as we, talked about this morning in the presentations, leads to shifts in relationships with peers, feeling left out or out of sync, and their relationships to their support system and the needs within them also evolve throughout the active treatment experience and leads to significant strain.
All right, from this, we're going to move into talking a little bit about the transition from pediatric to adult care. So we want to really highlight this as it does happen for a lot of AYA patients, but it often can differ a lot depending on the specific hospital or clinic or hospital system that a patient is being seen at. So we're going to kind of talk about it in some broad areas, knowing again that it can vary. So one thing to highlight too, which again I know Kyle spoke about this morning, being the oldest in the pediatric department. So often it's one or the other. We do see young patients in sort of adult settings that often feel like, it kind of especially brings up those feelings of like, this shouldn't be happening to me. I shouldn't be here. I'm the youngest person in the room, and also feeling like everyone's looking at me. They, know that I'm so much younger than them and that they feel sorry for me. I shouldn't have to be here. So there's that. And then a lot of times there's also the opposite of being the oldest in like a kid's waiting room and feeling again really out of place, feeling like, again, I shouldn't have to be here. This isn't, geared towards me. This isn't really for me. Where do I fit in to this whole picture? So, just to kind of highlight for our experience at MSK, we don't have a specific age cutoff between the two departments. Our pediatric department is housed within the larger building structure where a lot of our adult treatment is provided. So it really will depend on the specific diagnosis of the patient or kind of how they get referred in. So there are some diagnoses that'll be treated both, like that are common in the AYA population, that'll be treated both in adult and both in pediatric. Like we've had experiences where we've had, a 25-year-old with the same diagnosis be treated in peds and be treated in adult. And it can be a vastly different, experience for them. And that's really kind of where our program comes into play, and where I think a lot of AYA programs try to help is really around kind of filling in some of those gaps, really kind of figuring out where the added support is needed, sort of how to match the experience more to the patient and not necessarily trying to get the patient to fit into the clinic that they're in. Oh, and this photo here is our young adult lounge. So again, trying to have a dedicated space where patients who are young adults can go outside of a clinic setting where they feel a little bit more, at ease, hopefully, where there's some games and snacks and other things to kind of feel a little bit more like themselves. So there are a number of reasons why some patients will transition from pediatric to adult medicine. And again, vary on, based on the hospital and also the patient. So a lot of times, unlike MSK, it is very separate, the two departments of adult and pediatric. And so for some, there is a very specific age cutoff. So for some, it's if you're 18 and under, you're going to peds. If you're 19 and over, you're going to adult. Like that's kind of what it is. And then for some, there's also, as you get older, you have to then go to the other department. Unlike, as Kyle was saying, his experience of being able to stay in pediatrics. So when those transitions happen, a lot of times we do see, that it can have a strong impact on the individual and their support system. the way that care is provided within a pediatric department versus an adult can look very different. Again, in pediatric departments, it's a lot of wraparound services. It's a lot of folks who are typically very involved in the patient and their family's care and sort of the day-to-day. There's a little bit more, for lack of a better say, sort of hand-holding that goes along with it. Whereas on the adult side, our young adults are really faced with having to oftentimes do more of their own proactive kind of outreach and communication with the medical teams. And so, I think with some of that, it can feel like a big shift for patients. And, another aspect that definitely comes up is in terms of the dynamics with caregivers and with, generally in terms of communication with medical teams. Often in the pediatric setting, it's a child, right? So and in our case, a lot of times adolescent or kind of older adolescent. And the parent is usually the go-to kind of person for communication. Oftentimes they're the ones that are, again, like scheduling appointments and figuring out logistics and handling insurance and billing questions. And so then when they transition to an adult setting, that can really shift. And a lot of times the providers are really looking more to the patient themselves to be not only making their own medical decisions, which they are in pediatric as well, but it's a different dynamic a lot of times where there's also like an encouraging of like wanting to really empower this young adult to manage their own medical care, which also means understanding more around scheduling and logistical things. So there's just a lot of kind of shifts in dynamics that we often see between, again, the caregiver, patient, and medical team. And something that, again, often there is extra support needed around, even just how to prepare, what to expect when you're going into the, adult department, how that's going to look, what your communication can and should be. Again, this idea of sort of like the ability to and feeling the responsibility of like making their own decisions without as much input sometimes from caregivers can bring up, again, the complexities of the dynamics between the patient and their caregiver, especially if it's a parent or parental figure. And sometimes parents need a lot of support around that too. If their voice had been really a strong one, but now they're kind of sort of being encouraged maybe to sort of take a little bit more of the back seat so that the patient can be a little bit more engaged in their care. So again, this can really vary, but when it does happen, we like to really, try to pay special attention to it. As again, there are some unique factors that as support people we can help with. So we are now going to talk about a couple of additional transitions, one of which is moving into survivorship. So according to the most recent published data from the National Cancer Institute, the 5-year relative survival rate for patients diagnosed as AYAs is 89.5%, which means that we have and will continue to have many young adults transitioning to survivorship, as it's called typically, after completing treatment. With survivorship, there can come some challenges of its own. Often people associate completing treatment with a sense of joy, relief, and overall well-being. However, we do see that the emotional response can really vary and can often be pretty complex. Some patients mention, especially feelings of uncertainty about what comes next for them. How do they move forward? And what does life look like now after all this time that it was put on hold? Many patients also describe a shift in perspective on life. They may question if they even want to return to the job that they had before, or if they want to continue studying the area that they had been studying. There's also sort of this realization sometimes that life really doesn't just stop during cancer treatment. So bills may have piled up and regular life responsibilities are really coming back in full force, and they have to figure out how they're going to manage and navigate that. Part of what contributes to the emotional coping concerns is also the separation from a patient's medical team. When going into survivorship, many patients and their caregivers have formed a bond with their medical team and the support people who are in the hospital. And seeing them and getting treatment was providing a sense of safety and reassurance to them. It was like, okay, we're doing something and someone's keeping an eye on me and we know that we're, addressing my disease. And then when they're told, great, you're done, that they don't need to be seen as often, they're, instead going to be monitored on a certain schedule with scans and or blood work. It can feel for many people like a loss. They can feel or have described feeling a bit untethered, worry about how they will manage things more independently after having been so thoroughly kind of looked after and cared for throughout their treatment. And then really thinking about the support systems even that they have outside of the hospital, these have a tendency to shift. Many patients do report that at the start of treatment, they have like an outpouring of love and support and offers to, do things for them. And then as time went on, that kind of lessened or sort of fell by the wayside for some people. And when patients get to survivorship, they often find that family and friends just sort of assume that they're okay and that they should be back to normal since they're done with treatment, which, as we heard from this morning's speakers, that's not really the case. And then in addition, a lot of patients also experience lasting or late effects from their cancer. So again, these manifest in emotional concerns, but also physical, and can sometimes be what we refer to as semi-visible or invisible. So for example, maybe their hair is growing back, and so that kind of makes it seem like they're getting back to a sense of normalcy, but they have really bad neuropathy, which no one can see, but they can feel. And it greatly impacts how they move physically through the world and how they're able to do certain things or not do certain things that they were doing before. In addition, sexual changes and changes in body image are really common for young adults. So again, having a huge impact often on relationships. Again, in survivorship, sometimes the idea of going back into dating can feel really overwhelming, or reconnecting in a physical or intimate way with a partner. Again, life didn't stop while they were going through treatment. So also, again, their peers were moving on with their lives, and patients often feel that they missed out on certain milestones, or again, feel kind of out of step, out of sync with their peers, which can be really emotionally overwhelming for a lot of people. In addition to survivorship, we really did want to mention living with advanced disease. So there are many patients for whom their cancer is not curable, and they're faced with living with advanced cancer. There are a number of terms for this. So, some people might call it terminal cancer, stage 4, metastatic disease. It can depend on the type of cancer and where in the body it has spread. But when this comes up, transitions in the goals of treatment or in the goals of their care really change as well. So when patients learn their cancer has a very low likelihood of being cured, they are often faced with thinking about and discussing with their medical team what their priorities are and how best to meet those through treatment and supportive services. So for some patients, they may have a less aggressive type of cancer that can be maintained with regular treatment, and they can live a relatively full life for some time. For some young adults, this means really kind of looking at, okay, I know that, I'm going to be okay on this treatment for a bit, but I know that at some point it's going to change. Like we know that it's not just going to ever be over. The rest of my life, I'm going to be on some type of treatment. And so really contending with the idea of what that looks like in their day-to-day life and how they're optimizing time with family, friends, children, doing the things that are important to them. And so, there are also obviously other patients, unfortunately, that have, potentially because of a delay in their diagnosis, they have found to have extensive disease that is aggressive or fast moving. So this cancer may not be as responsive to treatments as originally hoped. And for these patients, the focus really might shift completely to palliative care, or addressing pain, nausea, side effects, and emotional concerns, while trying to optimize the time that they have with family, friends, and loved ones.
So now that we've kind of talked about a lot of the challenges and transitions that come up, we wanted to switch to where do you all come in, and how can we provide some concrete takeaways and ideas for how to contribute to supporting these patients through their cancer experience. So self-advocacy within the medical system is so important, but can really be so difficult at any age. And I think we spoke about that a lot this morning in their presentations, just about the importance of this, but that it's not something that necessarily comes easily or naturally to a lot of us. And as Alexandra spoke a little bit to as well, AYAs specifically, some of those younger AYAs may be really used to their parents or caregivers managing their care for them and being the primary communicators with the medical team. They may think that they should defer to the medical team because, they're the experts, they know what's best. And they, as patients, haven't had a lot of experience with medical things or, of course, with their cancer. And it can be really uncomfortable to ask questions or talk about serious things when you're not used to it, or, even with providers you may not know very well yet. But it is really important for patients to share their priorities and values with their medical team and with those involved in their care, because that allows everyone to provide the best care to them and improve their quality of life. So a few kind of concrete things that we recommend encouraging young adults to do is to learn about their specific diagnosis and treatment options. As some of the presenters this morning said, they didn't even necessarily know what cancer meant at the age they were diagnosed, or they knew what it was, but in just like a very broad term. So learning really about their specific diagnosis and treatment options, and doing this by speaking with their care team honestly and openly, looking online, but of course, looking online carefully. So important to remember that not all websites are reliable or trustworthy. So asking their care team for suggestions about where to start, and of course, some go-tos, the American Cancer Society or National Cancer Institute, we always recommend are good places to start. We also recommend thinking very critically, especially for young people who are on social media a lot, about the information that they get there. So obviously social media has a lot of opinions, a lot of wrong or outdated information that may not have scientific facts or evidence to back it up, but it can also have some really great opportunities for connection and from learning from the cancer community. So just reminding young adults to think carefully about what they do find on social media. What worked for one person may not necessarily work for another, and to always speak with their care team if they're going to try anything new or if they have a question that comes up from what they do learn on social media. And then encouraging young adults to advocate about their needs. So seeking out resources to address things that come up outside of just the literal medical care, whether that's related to finances, career, school, legal issues, and to ask for support. Ask their friends and family to be involved in their care to their comfort level and choosing who they want to be involved. Help them to keep track of things, advocate with and for them, accompany them to appointments so that they're really, not going this alone. And then, of course, as all of this, kind of leads into, very important to communicate openly with the healthcare team. And this can be really challenging for, again, anyone at any age. But sharing how the patient is feeling, what they're thinking, and asking their questions. So to get a little more in the weeds on that, it's important for patients to understand their treatment options and decisions, and to be able to speak to their medical history. So being able to share with their medical team things from their past, or as they move into survivorship, being able to report on what they've experienced through their oncology care to other providers. So especially, again, this is a challenge for any age, but for young adults who maybe don't have as much experience having to keep track of these things for themselves, recommending that they speak with their family members to collect this information, use notes, and have a way of kind of keeping track of all that. Encouraging patients to have a concrete list of questions for their healthcare providers before their appointments, things that come up in the weeks in between treatments, or even if it's a day in between treatments, writing them down as they come up, either on paper or on their cell phones, finding some way just to make sure they're keeping track of them throughout the time in between appointments. and letting the care team know that they have those questions for them and that they would appreciate having time set aside to speak with them about their questions during the appointment. A lot of times, patients can feel, as we said, the doctors, the nurses, the medical providers are the experts, and they may feel embarrassed or uncomfortable clarifying or saying that they don't understand something. But of course, this system is brand new to them. It's difficult to understand a lot of the intricacies. So making sure that they speak up for themselves and clarify if there are new words that they don't understand, asking about what can I expect during this upcoming procedure, if anything is unclear around their treatments or instructions given related to, say, medications and prescriptions. Ask those clarifying questions. And also explore what they can expect in terms of how treatment will affect their quality of life, and share with their team their priorities and hopes. Are there certain things that they want to be able to keep doing? Is there any way to work with the patient and their treatment to really enhance their quality of life throughout this experience as much as possible? And then, it's really okay to explore your options for patients. So seeking out second opinions, especially with something as big as a cancer diagnosis, is very common, but can of course be a little uncomfortable. But we encourage patients that if that's something they would like to do that, and to also do their own research, and again, from those trusted and reliable sources, and bring those questions to their doctor. So although the doctor may be the expert on your cancer, you're the expert on yourself and what you need and want. And so, bringing those concerns, those questions, what you've learned to your team, and really having it be a back and forth. And then finally, most hospitals and healthcare systems have a lot to offer outside of, again, just the concrete medical care. And so asking your medical team for referrals to resources. This can be related to finances, practical things such as transportation to appointments, social work, help navigating insurance questions, even complementary medicine. Patients, if they don't think to ask these types of questions, or they don't even know these types of supports exist, the medical team may not always think to connect them with them. So we, hope in our roles and through, some of your roles, being able to educate patients to all that is available so that they can advocate for what they really need and how to be connected. And then, of course, as has been discussed, mental health and psychosocial support is so important throughout all of this for patients. There's a lot of emotional and psychological impacts of a cancer diagnosis and treatment. So it's important to encourage young adult patients to seek out support for their mental health, whether that is through therapy, psychiatry, or support groups. If patients feel comfortable and open to it, peer support and building a community within the cancer space can be so beneficial, especially for young adults who, as we've said, can feel so isolated, can feel that they're the only ones when, as we all know, that's not true. So encouraging them to engage with those peer support resources, some of which we've heard about already today, as they feel comfortable and open to it. And remembering that sometimes patients' interest in that will evolve. I've certainly had patients who told me, absolutely not, no interest, no thank you, don't bring it up again. 6 months later, they're into survivorship, or they unfortunately have a recurrence of disease, and now they're joining our support group every month. So, just reminding patients this is always available if and when you are interested in it. There's no pressure to engage, but we want you to know what's out there. Patients also helping them to engage with their support system who want to help but may not always know how. So encourage patients to consider specific ways that it would be helpful to get help from those around them. So maybe that's setting up a schedule of visitors, people to come with them to appointments. I have a young patient who her entire family of like 8 came with her to her first treatment appointment because everyone wanted to be there. No one knew how to help or what to do besides just being there. And I spoke with her individually, and she said, yeah, it's actually a little overwhelming. I feel like I'm hosting them, and I'm feeling like I'm having to entertain them. So I said, okay, what if we talked about setting up a schedule for them? So everyone can be there to support you and also do something that maybe feels good for them and helps them cope, but in a way that works for you. So something like that, maybe having someone manage, text messages and outreach that comes in, or sharing updates. Sometimes they designate someone who posts on Facebook monthly for them because there's such a community that wants to support them, but it's too overwhelming for the patient to be managing it. Or even just, someone to pick up groceries for them, or a classmate to bring them the homework they missed that week in school. And then finally, in your role, you can also be impactful in helping patients connect their existing supports with those that they're now receiving within the oncology system. So for example, school social workers can collaborate with hospital social workers or nurses or other members of the care team to address the needs of the patient together and holistically. It's really important for these organizations to collaborate with one another and really be able to care for the patient as a whole. So again, just an example from my experience, I had a patient who is in college. She had surgery for thyroid cancer. She was kind of, just onto surveillance from that point forward in terms of her cancer diagnosis, but still really struggling with some of the mental health aspects, both of the cancer diagnosis and just of being a college student. And so I was able to collaborate with the campus counseling center to help advocate for her and get her connected with the proper resources in the setting where she currently was. So being open to collaboration with all of the other support systems and providers in the patient's life.
So we have put together a few things that you've probably seen some of this morning, but just wanted to highlight again. So through MSK, we have some of our own kind of offerings specific to the young adult population. Rachel and I facilitate a virtual young adult in treatment support group twice a month, which is a really kind of incredible setting for patients to get to support one another, share with one another. So we're really grateful to have the opportunity to do that. And then, in addition to Crossroads for Hope and the incredible work that they are doing in this space, a couple of the other national organizations, of course, Stupid Cancer, and we're hoping to have some involvement with CancerCon in August. And then Elephants and Tea is another wonderful organization that also does a really nice job of sort of organizing what is happening at other organizations. So they are often for us a go-to spot to refer patients. And then there are a few other types of retreats and camps. So we try to keep an updated list of those things as much as we can. But there's a lot of really incredible things going on in the community that are available to AYA patients. So we try to make sure that people are aware of those so that they can access them. Okay, that is what we have for today. Thank you so much, everyone.
Yeah, thank you, everyone. We'll be up here if anyone.
Yeah, we'll be up here for a few minutes, and our contact information is here too.